You are watching Access LaPorte County, Channel 97. Coming up next is the January 24th, 2023 meeting of the LaPorte County Board of Health. You can find more information for this meeting by visiting www.accesslaportecounty.org.
I now call the meeting of the LaPorte County Board of Health. Today is January 24th of 2023. And Jules, you have the roster?
I do, yes. Mrs. Arnold? Present. Dr. Dora?
Here.
Dr. Uhas?
Present.
Ms. Lawn?
Here.
Dr. Manning-Cox? Dr. Nelson?
Oh, okay,
Here.
I see.
Okay. We are good to go,
Ellie.
Doctor.
Okay, thank you. Next item on the agenda is the election of officers. Do I hear a motion to nominate president?
I would like to make a motion to retain Dr. Uhas as president of our LaPorte County Health Board.
Do I hear a
I'd
second?
like to second that.
I'm sorry. Who was that?
That was Ally.
Ally.
I'd like to second that.
Thank you. Okay. All right. Is there, so we have a second. Any discussion?
How do you feel?
How do I feel? I'm okay.
You okay?
Oh, yeah. Oh, with this, yes. Of course. I'm a little tired, but, it's cold out. And when you see a doctor, you got to start, with the complaints on my back, too. But, all right. All right. So let's take a vote then. All in favor?
Aye.
Doctor, if we could do the roll call vote because we have someone via Zoom.
Oh, yeah. All righty. Let's say your name and make your vote known.
Pat Dura, yes.
Lauren Arnold, yes.
Georgetta Manning Cox, yes.
Mark Nelson, yes.
Okay, I guess me, yes.
Ally Lawn.
Ellie Lawn, I keep looking down there and you're up there, Ellie. Hi.
I'm sorry I'm not there. Yeah, this is Ally Lawn, yes.
Okay, thank you. So it's unanimous. Thank you, everyone. And it is my pleasure to serve again. Thank you for having me. The next item on the agenda is Vice President of the Board of Health. And I will entertain a motion for a name.
I would like to nominate Dr. Dora as vice president.
I second.
Okay, we have a second. Is there any discussion? Dr. Dora, how are you doing with time? Are you able to do that with your practice and everything?
Yes.
So are there any comments beyond what we just had? If not, we'll take a vote. All in favor, say your name and then cast your vote, please.
Pat Dura, yes.
Lauren Arnold, yes.
Dr. Uhas, yes.
Mark Nelson, yes.
Georgetta Manning Cox.
At this point.
Sorry. Georgetta Manning Cox, yes.
Okay, the ayes have it. Welcome, Doctor. Congratulations. All right, next item on our, let me just start marking things off. Selection of legal counsel. I will entertain a motion for a nomination or more for legal counsel to the Board of Health. Does any,
And I would like to make a motion that Friedman and Associates be retained.
is there a second?
Second.
Okay. Any further discussion? Hearing no discussion. Ally, we're all good. All right, let's take a vote. State your name and your vote, please.
Pat Dura, yes.
Lauren Arnold, yes.
Dr. Uhas, yes.
Mark Nelson, yes.
All right. And how do you feel about it? Are you guys available?
Yeah, absolutely, Doctor. We're happy to help, and thank you for the vote of confidence, and we continue to work with you all and look forward to it. Thank you.
Thank you. And thank you for your service. You guys have done a good job for us this year. All right, so legal counsel is done. And now approval of the minutes from October.
Doctor, I'm sorry to interrupt. In that roll call vote, I think we missed Miss Lawn's vote.
Oh, I'm sorry, Ally. I apologize. I have to get used to
So
looking.
that's okay. It was already unanimous anyway, but Ally Lawn, yes.
Okay, thank you very much. Thank you, Nelson. All right, so Next item is the approval of the minutes from October 11, 2022. Do I hear a motion to approve the minutes?
Make a motion, we approve the minutes.
Okay.
Second.
All right. Any discussion? If not, let's cast our votes, starting with Ally, so I don't forget her. Can she vote up there?
Ally Lund, yes.
All right, thanks, Ally.
Pat Durrell, yes.
Lauren Arnold, yes.
Dr. Uhas, yes.
Mark Nelson, yes.
All right.
Georgetta Manning Cox, yes.
Okay, so it's unanimous. We accepted the minutes from October of 2022. Next item is public comment. Is there anyone that would like to make a public comment? Please state your name.
Good afternoon. Thank you, President Uhas. Commissioner Joe Haney, President of LaPorte County Commissioners. I just want to say a special thank you to the Health Department with the flood that we've had here, to Director Landers and her staff. They have been extremely accommodating.
Could I ask you to speak into the mic? And I'm not sure it's on.
The light is on.
Is it
I
on?
apologize. Is that better?
Okay, yeah, it is better.
Sure. All right, well, thank you. Commissioner Joe Haney, President of the LaPorte County Board of Commissioners. I want to say a special thank you to Director Landers and the entire Health Department. Their staff has been amazing as we've gone through this flood. They've been extremely accommodating, and they've worked very well with the environmental specialist as well to ensure that conditions here in the building, are safe, and as well as their staff has been amazing as they've relocated to either A Street or the courthouse, depending on where they needed to go. So I just want to say a special thank you, and they've gone above and beyond, and want to take a moment to recognize Director Landers.
Difficult situation for them, and they're doing a great job.
Absolutely.
So thank you, guys.
Absolutely. Thank you all. Have a good afternoon.
Okay, thank you, Commissioner Haney. Well, next item, Health Officers Report.
Hi, Happy New Year to everyone, a bit belated.
Happy New Year, Doctor.
But as if you've had a chance to read my report, as I said, welcome to 2023, which in many ways is starting out like the last 3 years. We continue to have ongoing issues with multiple viruses, the so-called triple endemic, I can't even say it, including influenza, COVID, and RSV. Monkeypox at the beginning of the year was concerning to many people, particularly worldwide, that it was going to make a huge inroads in different areas, and it never did. So that's the one good bit of news when it comes to viruses right now. So that hasn't done it. RSV has been a huge issue. Now that's respiratory syncytial virus. And the biggest issue, of course, is the younger children. There is no immunization for it. It is very young or immune compromised are at the risk of severe illness. And as I said, not to repeat myself because you can read it, but 58,000 to 8,000 children younger than 5 a year are hospitalized. It peaked very early this year for reasons that are a little bit unclear, and thankfully the numbers have gone down significantly. There's no specific treatment for it. Some of the antivirals are being tried, and hopefully an immunization is going to be in its future, in our future, but it is not there at this time. But luckily, it's going down. Influenza also peaked early, and that was primarily influenza A. The numbers are down dramatically, which is very good, but there is concern that there's going to be a second wave of influenza B. So there's still, unfortunately, a lot of people without vaccinations. So that usually comes a little bit later in the winter into spring, and we'll see whether that happens or not. 70% right now have been the H3N2, and the rest are H1N1. But like I said, at this point, there's up to 22 million people that are reported. Of course, it's kind of like COVID these days. We really don't know how many people have this because so many people are not getting tested. But it's been significant. There's been 14,000 deaths so far that have been attributed to the flu. So hopefully B won't get us in the same way that A was getting so many people. Again, the prevention. It's using all the social mitigating factors that we have learned to use through COVID and don't use anymore. And of course, vaccination really is important. So that's all we can do. There are antivirals out there. There's been reports in a number of different areas that it's been difficult to get the antivirals. I'm sure you've seen it all in the news, plus some of the treatment for the flu, such as fever reducers, that type of thing. That, again, seems to be improving. So hopefully, when and if B hits us, it won't hit us with the same kind of vigor that it did this time, or that A did. So, COVID, fourth year. Looking back, obviously it's hugely different talking about it now than at the beginning. We've got medications, we've got variety of different treatments, we have vaccinations, and it is much better. Again, unfortunately, so many people have become very complacent about it. The vaccination rates are dropping. People are not getting their boosters, and it's still mutating out there. The newest subvariant is XBB 0.1.5, and about 40% of U.S. Cases right now are associated with that. And when I wrote this a couple weeks ago, or about 10 days ago, I guess, it had increased by 20% over the week, and it has continued to increase as being the primary one that's causing these issues at this time. The degree of protection from immunizations and boosters is being monitored, but it appears that for this specific variant, it's still working fairly well. So obviously we continue to encourage people to keep their immunizations and boosters up to date. And the hospitalizations, as of today, the hospitalizations, when I sit in here, were trending up. They were. Since I wrote this, actually, the deaths were trending up, but over the last week or so, they've started to trend down. And the hospitalizations and ICU usage is also trending down at this time. So hopefully it'll continue to go that way. The big issue at this stage, of course, is with China having the problems that China is having, which was basically trying to solve it by locking everybody in, and now letting everybody out without adequate medications, without adequate immunizations, and with the Lunar New Year, there's a huge amount of travel, and there is concern how that may affect the rest of the world, and that's still something that's going to be seen over the next few weeks. And again, boosters are really important. Right now, when I wrote this again, 15.4% of the population have had a booster. That's it. So, I mean, obviously we still have continued ongoing problems. We're still having deaths, and it's just something that we're still living with. And obviously easier than we would have talked about this in March of 2020 or a little bit after that, but still continues to be an ongoing issue, both with mortality, morbidity. If you read much about it, one of the major issues they're talking about now, of course, is long COVID, which is just devastating number. They're not even sure how many, because there's no specific diagnosis for long COVID, but certainly by the way they're starting to piecemeal it together in terms of symptoms and what will qualify, there's a lot of people being put into that group. So obviously it's still something that and a lot of the people that had the COVID, weren't the people that were in ICU coming out with it. They were the 25-year-olds that now can't work because of it. So COVID still haunts us all right now. I think that's my report, unless there's any questions.
Thank you, Doctor. Are there any questions for Dr. Ducey? If not, I will entertain a motion to accept her report.
Second.
Any discussion? If not, let's take a vote. Ally? So I don't forget.
Ally Lyon,
Yeah,
yes.
yes, okay.
Pat Durrell, yes.
Lauren Arnold, yes.
Dr. Uhas, yes.
Mark Nelson, yes.
Etta Manning Cox, yes.
Okay, we have now unanimously accepted Doctor's report. Administrator's report. Amanda?
Good afternoon.
Good afternoon.
That was the microphone, Ally. Not me.
Not you, Karen.
Good afternoon. I'm going to try and be brief. I have some big subject items to get through this afternoon, and I don't want to have to poke you out to keep you awake, so I'll try and keep them brief but informative. I'd like to start with the Governor's Public Health Commission. I hope that you've all had a chance to review that video that I sent the link out for. If not, it's available on YouTube. If you'd like to watch it again just for giggles. There's a lot of good information to be pulled out of there. But to go over it briefly, because I do have some hard numbers for us tonight, what we would be looking at. But the Governor's Public Health Commission was pulled together, was written as an executive order by Governor Holcomb in August of 2021. And he wanted this group to analyze the preparedness of the state of Indiana, how it responded to the COVID-19 pandemic, how the local health departments responded to that pandemic and these emergency situations, and what could we do to make it better. So this coalition was created as 15 individuals, and they looked at very specific areas. First, that emergency preparedness, again, how everybody responded, and then to make recommendations on how it could be done better. The second was to review public health funding, to see what the sources were, the current levels of that funding, and suggest how to standardize funding across the state, because it's very unequal from county to county as far as funds go, and also across the nation, how we rank with everybody else. They wanted to see how the local health departments were delivering services, how to best support the local health department workforce on how to plan and address shortages in staffing, either funds or being able to recruit people for these positions. We got to get better on our data. That was another big one, is data and information integration, how best to use data to support programming, but also how to better support and deliver public health services. If we're all still using Rolodexes and filing cabinets, that's very difficult and time consuming to get through. But if we all have an online database, a web-based database that you can easily access, we're going to be able to perform services a lot better and more efficiently. And also to review opportunities in child and adolescent health, how to improve school-based programs, public health activities, and to improve access for kids and adolescents to receive primary health care. So Indiana overall compared nationally, we do some things really, really good, like business. We're like 6th in the nation for business, 7th in the nation for business opportunities. 9th in the nation for pre-K through 12th grade schools, and 25th in public safety, so top half. Where we're not good is Indiana ranks 45th in the nation for smoking and tobacco use, 46th in the nation for obesity, 43rd in the nation for mental health, 41st in the nation for childhood immunizations, and 45th in public health funding. So what we do good, and what we don't do good is very obviously what we don't do good. And we can see that looking at some of the data, and that the life expectancy for residents of Indiana nationally is 2 years shorter than the national average. So all of that starts to add up little by little. And there are some counties where life expectancy, and luckily LaPorte County isn't one of those, but there are counties in Indiana where life expectancy for those citizens are 9 years shorter than the national average. Yeah, that's why we're 45th in the nation for public health. So one of the big things that came out of it, of course, is money, right? To see what's going on and what we can do better. And looking at the nation, the average spending per person for public health services is anywhere from $30 to $95 per person, per resident, per capita. What they found nationally, and even in home-ruled states, that the money for public health, 80% of the funding comes from the state, and the local government picks up 20%. not in Indiana. All of our funding comes from local tax dollars and fees. We get very little money, if any, from the state. And what we do get from the state comes in the form of grants, which may or may not be renewed every year. And then we have to compete for those grants as well. So, the plan, which has to be written into legislation. There's a lot of things that would have to change in the current law for the state to be able to do what they want to do. But their plan is to fund public health 80% to get our national average up, spending per capita. Currently, right now, in LaPorte County, and it's crazy all across the state. At some counties, it's quite sad, but right now, LaPorte County, what we receive from our tax levy and from our fees that we raise, we spend currently $16.59 per person. The grant money that we receive every year, and I'm not counting all our grants because some of those are just 1 year, but our one reoccurring grant adds that we get from the state as $1.04. So we're spending $17.63 per capita. Giving 80%, being able to keep that money and adding the 80% from the state of Indiana would bring us up to $48.59 per person. In order to accept that money, though, we have to agree to perform core services that have been identified by the Health Commission. And fortunately for us, we already do 95% of those core services. So we have a little bit of space that we would have to catch up. But the things that we are doing, we could do better. And with that funding and with the proper staffing, we could be just killing it. So that is currently right now in legislation. It's on the floor. It's being discussed. If it goes through, the plan is not to give us all that money at once. We would be getting almost $3.6 million from the state every year forever. This doesn't go away. We would be getting this every year. It would be written into law until they change the law. But we're not going to think that way. We're going to get this every year. And hopefully that'll get Indiana out of that 45th spot and bring us back up to where we need. So we have healthy children and residents, and we get those years of our life back on there and able to perform these core services that they've identified. And of course, that is vital records, communicable disease control, access and linkage to clinical care. So when we're seeing patients or having somebody in the community, being able to provide, signing people up for insurance, signing them up, getting them, identifying where they can go to get help is a big thing. How to respond and better respond and have permanent staffing to address health-related areas during emergencies and disasters, chronic disease and injury prevention, environmental public health, so wells, septic, foods, all of that, and then maternal, child, and family health. So that was a lot in a very brief, very shortened time span. I've listened to multiple presentations on the Governor's Health Commission, hours of it, and every time I listen to another presentation by Dr. Box, I pick up something different from it. The state has already started to increase their infrastructure and their staffing, and one of the things that they've done, because we're all in the same boat, all of us health administrators have a network that we work with one another. We are all flabbergasted by this amount of money that is coming in, and we don't know where to start or where to begin. So the state has hired strategic planners to work with us to help us to develop a plan on how to best implement changes and how to best use those funds within the county. So if legislation goes through, we would be seeing the first half of this money. They would give us 50% that first year in 2024, and 2025 and going forward, we will receive those full funds every year. We wouldn't have to apply for them. They would, as long as we're performing those, we would have to supply a report to them every year like I do now for our local health maintenance fund grant. And that would provide that report to them every year. They would approve our funds, and then January 1st, we would start receiving funds for that year. So, any questions on that one?
Yeah, the excuse me, the 3.6 million, is that a statewide or county?
That's for the county. It's per capita, and every county is different.
Okay, so for our county, that's the number you cited.
That would be, yes, those are
LaPorte.
those are our numbers.
Yeah, wow.
Yes.
Thank you.
93 of the public health 90 of the 92 counties in Indiana are below the national average for public health spending.
Below.
Below. Like way below.
Yeah.
Like within 25% below.
And that 9-year life expectancy deficit in some counties is really disturbing. 2 years is no, prize, but is there, and not to take you off the track on this, because I know you got a lot, but is there anything going on in those counties is that the opioid crisis, or smoking, or obesity, or diabetes, the usual?
It's all of the above, and then there's no resources. There's no primary care doctors. There's no hospitals in that area. So it's just a accumulation of all of that.
A lot of people don't have insurance in some of the outlying or the very poor states.
Exactly.
They don't qualify for Medicaid, but yet they, any of the marketplace ones are still too expensive for them to do it. So I mean, it's
If you don't.
uninsured, it's a huge issue.
Yes.
So by the time there is something significant going on, it's often just
It's
too late.
too late. Yeah.
We see that here in LaPorte County. Which is obviously shown by the numbers, but.
Yeah.
So those counties that have that big of a discrepancy, they get a little bit more money. There's another tier. There's 1, 2, and 3. We're number 2. We're in the second tier of funding, and they would be the third tier. So they would get a little bit more because of that life expectancy.
In general, life expectancy has gone down in the United States. In general, not just Indiana.
No.
I mean,
Yeah.
disturbing.
Yeah. So hopefully this passes and goes through legislation, and we start spending our dollars because you can still keep bringing in business, but if you don't have that infrastructure to be able to supply those employees with those basic health needs, they're finally going to stay. Like, we're not going to keep coming to Indiana if there's no doctors, if there's no funding to be able to get immunizations. So it's all connected. They need to start looking.
And
at
they
that
need
as
healthy
well.
workers.
Yes, exactly. If you're
strong,
calling off
healthy
sick,
people.
you're not being productive.
Right.
Right.
Wow.
Exactly. So, another big one is the septic roll, which we've talked. Yes, I'm sorry, Dr. Cox.
Thank you. Like you, the more I listened to that Public Health Commission report, the more I heard. Before, I had a problem with the fact that there was nothing about dentistry, and when I spoke at the League of Women's Voters legislative breakfast, there was the House Representative, what is that, Prixel? Pressel. Yeah, and I mentioned that mental health is really key.
They're asking to turn the mic on.
Or to speak
I'm
into the
sorry,
mic.
I'm sorry, thank you. I can't chew gum and talk at the same time. But how important mental health is, and particularly for the young. It's just that you don't think of that's important with the young, but we're trying to get a good, healthy workforce here so that when companies come, that they're able to draw from our population. And another thing which I heard, I was listening to this last night, was the fact of dental health. And those two are some of the core concerns. So I haven't heard too much mentioned about dental health. So I just wanted to kind of emphasize that's something that maybe we can be innovative and attack those two problems.
That is in part of the core services.
Yes, it is.
Yeah,
Yes.
yeah. So if we accept this money, it'll be part of our department. We will have to perform that core service. Yeah. Are there any other questions?
I had a quick question, Amanda. The grants that we typically apply for, are you still available to apply for them?
So some of them would be, some of those other grants will not be going away. One that would be going away would be the local health maintenance fund, and the trust account would be wrapped up into this funding now. Those other grants are still supposed to be out there and available, but they may, after a while, disappear. Yeah. Yes. Any other questions? Governors Public Health Commission? Nope. Okay. Septic rule. Septic rule is now open for public comment. It's open until March 9th. However, the final rule has not been published yet, so it's kind of hard to do public comment if you can't read it. So, they keep saying that's coming, you'll have it in 2 weeks, and that was 3 weeks ago. So, as soon as I have a copy of that and I have a chance to read to see what has been cut and what was changed, I will definitely send a copy off to all of you, because I know you want to read about the septic, because I do. I did some research about the environmental fund, and Julie Davies, found this fabulous book right here. This is the beginning of the health department. Oh, not that page. This is the beginning of the health department. The first meeting, November 14th, 1966. So, I'm not going to tell you how freaked out I was that this was damaged in the flood, and it wasn't. I almost wept for happy tears when I found that it had not been destroyed. But within this, this book goes all the way into, 1991, of all the minutes of the health board meetings. And ended in the early 83, there's a section in here when it's talking about the environmental health fund that Mr. Sandy was speaking about. That fund, that money has been sitting there all these years, and it has not been used. And I will say that I did have some awesome notes that I had taken and I was going to discuss about, and that unfortunately did not survive the flood. So I will continue to look at that. But the big thing is that it's not an ordinance, so we don't have to change any ordinance. It would be a board decision, we believe, on how to best spend that money that has been sitting there since the 80s that has not been used.
Do we have any insight into how much money is sitting there in that?
It's $58,000.
Okay. And is that invested
Some
in?
change.
Is that invested in something that brings in interest?
No.
Oh, it's a shame. I mean, just think about that. Right. So
After 30
I know
years,
you
yeah.
guys. Pardon?
After 30 years, yeah.
Oh yeah, that
40
was an
years,
opportunity
that would've
missed.
been-
But so I know you got your hands full upstairs with the flood. Do you want to hold off making any decisions on this and just kind of bring the board, to be aware of it, that there's
Yes.
money out there?
I would ask
Should
for
we
that.
gamble in the stock market a little bit? Mutual funds, bonds?
I don't know that we can do that with it, but I did want you to know that we did find that it was not an ordinance. This is
Yeah.
how it was handled, and we can, it's been there for 40 years. It's not going to go anywhere this year. So we have time to decide how best to spend those
Yeah,
funds.
no one else has dibs on it.
No,
Okay, so it won't go away unless we
No.
know about it.
Correct. I have to authorize those funds to be spent, so.
Yeah. Okay.
Margarita party, no. After this week.
Pizza for the board. I think that
Um,
sounds like a winner.
And I don't know, am I being briefly? No. So if you have any questions about the flood, I'll be happy to go into that, but briefly, again, I keep saying briefly, and then that's not happening. We did have a major flood on the 5th floor, the 25th of December, which affected everything in the northwest corner of the complex. I'm just calling the tower section from the 5th floor to the basement. There was 9 departments that were affected and have been relocated outside of that tower, except for the sheriff's department. They're still in place and working within in their office under certain conditions. I have been working every day. I've been here every single day since December 26th, assisting and working where I can and offering what help I can. We've brought in an environmental engineer who I've been working very closely with, assessing, doing samples throughout the building, and trying to assess our documents that, as we know, as the government, we love our paper, we love our documents. There's stuff we have to keep forever, and there were some that have just been severely affected, not only with possible growth on it, but also water damage. So now the assessment begins shortly once we get in a better place to start looking at those, how best to preserve and save those documents. But also, again, just making sure that we all are going to have a healthy workspace to return to at the end of this project.
What about computer systems? Were they damaged, and are you repairing, replacing?
There was a lot damaged. There was a lot lost. Some of those that we thought were okay, we have been using, and then a couple of days later, they're not. So even those that we thought were okay are not. So it's going to take some time before that overall scope has even been decided. We just keep plugging along, though.
I know you guys are up
Yeah.
there.
Yeah.
And medications, vaccines, all those things are,
Our vaccines were unaffected. We were able to get those transported to Michigan City rather quickly. And that, it's fascinating how water moves through things, and it just kind of like went around that room where our vaccine refrigerators and freezers were. So we got lucky there.
so could you tell to the audience, anybody that might be tuning in a little bit later on Alco TV, how your services are now affected and what you guys are doing here, if anything, what you guys are doing on 8th Street, and what you guys are doing in the courthouse, so the public kind of knows where to go for things.
Of course. So there's nothing open here, to put it short. The health department has been relocated to Michigan City. Fortunately, 8th Street offices had not been sold yet. I know they were getting prepared to be sold and put on market, but thankfully we still had that building. So we've reoccupied our old space on 8th Street at 302 West 8th Street. In there, we are doing vital records and environmental services. So our septic, wells, food are all out of that office, as well as my administrative staff. Over at the courthouse, we have all of our nursing services. All of our nurses are there, their support staff, and as well as vital records also. Also at 8th Street is now the building commissioners. The coroner is there, and we're using that for storage. Prosecutors were able to relocate to Michigan City as well. EMS is still on property, but they're in the basement in this section of the building that was not affected. They're right underneath of us.
Good.
Yes, so that's what's available. So we're still up and running. Unfortunately, the only thing that's not operating and will not be for quite some time is the water laboratory.
Is the what?
Our water lab,
Okay,
yeah.
because that moved right into your department.
Exactly.
The water's there.
Yeah, yeah. We could test it for you.
Gosh.
And then I wanted to, nope, can't do it. So that's my report if anybody has any questions.
Yes.
Yes, ma'am.
I wanted to know, have you had a consultation with other government agencies that are keeping in storage, these vital statistics? And what are some of the new ways or innovative ways of keeping these records on hand? Because I'm quite sure that there's some new technology, which we could look at and get an estimate out on whether or not the feasibility of using these new technologies in order to be able to keep these records safe. And I'm thinking too that so many government agencies are being attacked as far as bugs and so forth, whether or not that might be something that we look at right now as well, since we were looking at trying to keep these records safe.
That there's always ongoing conversations about that. We are moving to digital records where we can, but there are some things that we do have to keep a hard copy of for in perpetuity, forever and a day. We have to have a hard paper copy. But we do have some web-based services that we are currently using for records. We have that web-based service, but we also have to have that hard copy. And we do our internet, our security now is kind of crazy because we were hijacked several years ago, the year before COVID. So 2019, we were hijacked and ransomed. The county was.
And another thing I was thinking about, well, do you have containers or boxes that are waterproof, things like that, so that you don't have to worry about, the thing, it could become an ocean down there and they still would be safe.
Mm-hmm. Right, again, and some of those documents go back to the 1880s, so we do have to be careful on how they are stored and necessarily putting them in a airtight container. We are going to look at talking with the archivist to see best going forward how we can protect those very fragile documents. But yeah, there's lots of different discussions going on right now.
Good.
Thank you.
Amanda,
Yes, ma'am.
one more question. Just for the public, are immunizations and vaccines being given on 8th Street or over at the courthouse?
The courthouse. All nursing services are at the courthouse.
Okay.
Yes.
Thank you.
Yes, we're still doing COVIDs on Wednesdays, immunizations Monday and Tuesdays.
Okay. Thank you.
You're welcome. Thank you.
Did you just do our environmental health and food division report? It's kind of on your page. Or do we have that?
No, yeah, it's Tricia's here.
Yeah, no,
Oh, no.
I see it.
Aren't you tired of listening to me yet?
No. All right, let's go ahead and do the environmental. Trish?
Good afternoon, everyone.
What?
You didn't accept the report.
Excuse me. What happened?
We just need to accept the
Yeah,
reports presented.
That's right. Okay. We need to accept the report if there's no other questions or comments. Ally, accept the director's report.
Ally Lawn, yes, accept, please.
Okay. Doctor?
Mark Nelson, yes.
Dr. Uhas, yes.
Lauren Arnold, yes?
Pat Dura, yes.
Okay. It's accepted, thank you. Then going on to the Environmental Health and Food Division report.
Okay. Good afternoon, everyone.
Good afternoon.
I'm going to start off, but the fourth quarter seems like it was years ago with everything that's been going on in our office, so I'm just going to give you some numbers about what happened in the fourth quarter. We had 696 water samples that were analyzed, and of course, the lab is now closed, so almost 700 samples that will not be done anymore until we reopen. We had 45 well permits that were issued, 44 septic permits, and 136 property transfers. In health education, we had 6 health education events that were done, 2 Narcan trainings, 295 doses of Narcan were distributed, 2 harm reduction trainings, and 16 car seats that were distributed. We had 201 food inspections, and you saw the new establishments that were listed on the report. 19 environmental complaints, and 3 lead assessments that were done. I am going to mention what Amanda could not mention just a minute ago. We had a long-time environmental secretary. She was with the department for 32 years that passed away on Friday. Very unexpected, and the department is devastated by the loss.
We're sorry for her loss, and prayers.
That's all I have. Thank you.
All right, any questions for Trish? If not, I'll hear a motion to accept her report.
Motion to accept.
Is there a second?
I'll second that.
Any discussion or anything? You guys have to say your name. Please say your name and give me your vote.
Ally Lawn, yes.
Pat Durrell, yes.
Lauren Arnold, yes.
Dr. Yass, yes.
Georgetta Manning Cox, yes.
Mark Nelson, yes.
All right, we're set with that then. Well, next item. Director of Nursing is up
Yes.
there.
Good afternoon.
Ready?
I'm just going to do a brief synopsis of the fourth quarter of last year. We did finish up our flu clinics. We did 3, we did 2 clinics at the health department and 1 clinic at the county highway department. We had to resume Ebola monitoring last quarter based on the CDC's advisory about the recent outbreak of Ebola in the Republic of Uganda. And so we had to monitor all travelers that returned from Uganda. So basically, we had to do a risk assessment, determine what part of Uganda they were in, if that was a high-risk area, and then determine how often they needed to be monitored. And as quickly as we had to start monitoring, then they discontinued it in mid-January. So we no longer have to do any monitoring for travelers returning from Uganda. I'm going to briefly talk about the new lead rule that came out, in December. So the rule updated guidelines used for lead case management. The standard for an elevated blood lead level has now dropped to 3.5 micrograms per deciliter, and the benchmark for beginning lead case management services dropped from 10 micrograms per deciliter to 5 micrograms per deciliter. So now any child that has an elevated blood lead level of 5 or above has to have a home visit by a nurse and an environmental specialist. Also, the guidelines have changed for recommended blood lead testing. All children now, they recommend, regardless of risk factors, should receive a blood lead test between the age of 9 and 15 months. They also should receive a second blood lead test between the ages of 21 and 27 months. And then if they've never had one before and they're between the age of 28 months and 72 months, should also receive one test as soon as possible. So we were able to hire a contract nurse to cover some of these activities with the changes to the lead management rule with dropping the levels for action. And I do want to say there's a program out in Indiana for anyone wanting to quit tobacco use can now get free nicotine gum, patches, or lozenges. Through Quit Now Indiana, they're offering this promotion while supplies last. And Anyone who enrolls in one of their services, they will receive a free 4-week supply of nicotine gum, patches, or lozenges. And they can enroll by calling 1-800-QUIT-NOW, texting READY to 200-400, or visiting quitnowindiana.com. Any questions?
Thank you, Jenna. Anybody have any questions for Nurse Jennifer Smith? If not, we can take a motion to accept. Is there a motion? Is there a motion to
Accept.
accept?
Second.
Okay. All in favor, please vote and say your name. Ellie?
Ally Lund,
To
Pat
accept.
Dura, yes.
Lauren Arnold, yes.
Dr. Uhas, yes.
Mark Nelson, yes.
The Manning Cox, yes.
Okay, the nursing report is accepted. Thank you, everyone. Unanimous. Next, attorney's report.
Good afternoon, everyone. Again, thank you for the appointment and the confidence in our firm to continue representing you all. The fourth quarter, we've had several issues with septics, and we've been working with Ms. Wozniak on getting those corrected. Unfortunately, we do have 3 pending complaints, 2 regarding septic issues and 1 regarding general garbage and trash disposal issues. Those are making their way through the court system now. We're waiting for a court date, but unfortunately, the health department does everything they can to work with these folks, and it doesn't get done. So, unfortunately, we have to file lawsuits. So that's where we're at. We have 3 pending, and we'll continue to work those. If anyone wants any more detail regarding those situations, feel free to contact me. But because we're in a public meeting and it is pending litigation, I'll just let the board know that we do have some pending complaints regarding septic and 1 regarding the garbage issue. Other than that, I don't have anything else to report. And again, thank you for allowing us to continue to serve you all.
Thank you. Does anybody have any questions for our attorney? If not, I will entertain a motion to accept the report. Do I hear a motion?
Motion to accept.
Okay, is there a second?
Second.
All right, let's take a vote in favor. Say aye with your name.
Ally Lund, aye.
Pat Dura, aye.
Lauren Arnold, aye.
Dr. Uhas, aye.
Mark Nelson, aye.
Georgetta Manning Cox, aye.
Okay. Attorney's report is accepted. Old business. Revisit discussion on tipping ordinance. Are we going to do that today? Or is that something you kind of covered in that? Yeah. Do you guys know what that's all about?
Get
Okay.
that, so I'm do a little more research, and we'll have something more for the next meeting.
That's what Mr. Sandy brought up on his last meeting, that there was some kind of policy in the past, and when they were dumping or dropping off things in a dump, we got a cut as a county health department. And that's the money that we were talking about earlier, that $58,000 sitting out there. But right now, they need to finish up with the floor and the flooding, and this 58-year-old $58,000 is just not top of mind. So it's on the agenda so that we kind of remember it, and we'll bring it back up. But unless anybody has any comments about it, I don't think we need to pursue it today. Anybody have any comments or discussion about? Because it's not like tipping when you go to a restaurant. It's a little bit. Oh.
So do we need to table this then, or?
Yeah.
Yep, that's what I would
Yes.
suggest.
The best language for that is tabling it. Yes.
All right, then I'll make that motion that we table this to a later discussion.
Perfect. Is there a second?
Second.
All right. All in favor, please say your name and your vote.
Ally Lund, aye.
Pat Dura, aye.
Lauren Arnold, aye.
Dr. Uhas, aye.
Mark Nelson, aye.
Georgetta Manning Cox, aye.
Okay, so the ayes have it, and we're going to table that tipping discussion. Thanks, Ellie. That was a good way to put it. New business, the resolution establishing electronic communication And what that's all about is that policy that we got in via email telling us that we have one absentee day or Zoom day for the meeting, otherwise we get pinged. We get booted. And so, we really haven't discussed it. So I don't think we passed a resolution, did we?
So, Doctor, we did pass a resolution last year to be able to allow members to attend via Zoom. We have to have more than 50% of the members present to have a quorum to be able to vote.
Right.
And you couldn't attend more than two, you couldn't do two in a row?
Yeah, 2 in a row.
2 meetings in a row. The third one, you would have to be present.
So
That's what it is currently. So the commissioners passed a new resolution for the commissioners, updating their policy. And if we want to update our policy, as I understand it, to match that, or we can keep the policy that we have now in place.
That's right. The one that we previously adopted was the exact same resolution that the commissioners adopted regarding the COVID issues, right? It seems now that they have a new resolution that they've shared with us, and the board is welcome to accept it or not. The biggest difference is what Amanda indicated, is that previously you could attend, 2 and then come back and be physically present for the third meeting. Now they're saying that you can attend 1.
You mean via Zoom, not
Correct, electronically,
attend,
correct.
yeah.
Yes, attend via Zoom, I'm sorry.
Yeah.
And unless it's for a specific reason that's listed, military service, illness or other medical condition, death of a relative, or an emergency involving actual or threatened injury to persons or property. So if it's one of those reasons, then obviously you can attend by Zoom. But the previous resolution that we had it mirrored the commissioners, and that's what we have here today. This is the exact same resolution that they've passed. They've just suggested it to us as well.
Just what was the last part that you said?
They've recommended it or suggested it to us as well, so that we
Okay,
know.
but we're under no obligation to do the miss one and goodbye meeting.
Right.
All right, so I'm going to open this for discussion, because how would you, what is everybody's pleasure on this? I'd like to hear thoughts.
I feel that our policy that we had previously worked. I would like to keep it as is.
Any other comments? Doctor?
I feel the same way. Most of us are just volunteering for this. This is not some type of power trip or anything like that. If we can't make the meeting, but we can get it by Zoom, good. I don't think they should try and penalize us and say, hey, you really have to be here. We're going to make an effort to be here.
Right.
But I think our policy, as before, was more than adequate.
Dr. Cox?
I concur.
You concur. Dr. Doro?
I agree. I'd like to just leave it as it is.
Yeah, I'd like to leave it as it is. So why don't we do, and Ally, did I get your input?
We only have, 4 meetings a year. And most of us try to make it. No one's been abusing the policy. I mean, I'm the only person that is at home, and I would have come in if the quorum hadn't been made. Like I said, I'm just getting over shingles. So I really
Stay at home, rest.
Exactly. And I suggest to people, if you don't want to feel that burn, think about getting the vaccine.
Really?
But yes, I agree that our current policy has been working just fine for us. So why change it?
Yeah, I think what you said is we only have 4 meetings a year. That's true. But then we have weather, snowstorms, ice on the roads. And, some of us come in from, farther away than others. So I would say leave it the way it is. Is there a motion now to do that, or did I keep talking?
You don't need a motion.
We don't need a motion? We're just going to keep it the same way? All right. Everybody's good with that?
Yes.
Okay, thank you. We got a meeting coming up in April. And I have some Tuesdays we could look at if you guys can give me your how about the 18th of April? Take your time, get out your phones and.
I'm retired.
Huh?
I'm retired.
You're retired. And by then it should be spring-like.
hopefully.
Yeah. I agree. I'll second that.
I'm good with the 18th.
Good. All right. Guys, let me.
Are we-
so,
It's 18th's
Yeah.
fine with me.
Dr. Dora?
18th's fine with me.
18's fine. You're retired, so that, and that means you can make it.
Yes, I'll be here.
Doctor, are you going to be able to make it on the 18th?
Yes, I will.
Ally, are you going to be able to make it, God willing, on the 18th?
Yes.
Perfect. April 18th, we will reconvene. And unless there is something else, I will adjourn this meeting.